Welcome. Thank you for choosing to incorporate intraosseous anesthesia with QuickSleeper into your daily practice. The aim of this short video is to introduce the main characteristics that make this technique such a game changer when it comes to the delivery of local anesthesia injections. It will help you understand how it works, when to use it, and it will also supply a number of tips to ensure an optimal user experience and complete patient comfort. The goal of intraosseous anesthesia with QuickSleeper is to provide painless anesthesia that always works. The principle of intraosseous anesthesia consists of placing the anesthetic product directly into the cancellous bone, rendering an immediate anesthetic effect. By injecting into the box delimited by the buccal and lingual or palatal cortical plates, the anesthetic will diffuse inside the box, rendering the possibility to perfectly anesthetize various teeth with one injection. The number of teeth anesthetized, the length, and the effectiveness depend on three factors: the injection site, the product injected, and the quantity delivered. By taking these three factors into account, it is possible to anesthetize from 2 to 8 teeth with only one carpule injected in one particular spot, with a lasting effect of 30 to 75 minutes. There are two types of intraosseous anesthesia, and the difference depends on the presence of a septum at the chosen injection point. If there is a septum, then it is an osteocentral anesthesia. The objective is to penetrate the needle by 3/4 of its length into the cancellous bone, in between the two adjacent teeth, in order to be very close to the apices and far away from the septum. For an osteocentral anesthesia, we can generally use a fine 30 gauge 16 mm needle, but when faced with thick bone, it is also possible to opt for the 27 gauge 16 mm. The sensation during needle penetration is that of passing through various trabeculae, which can be more or less thick depending on the anatomy of the patient. When there is no septum, which is the case for an edentulous area or the retromolar trigonum, you will perform a transcortical anesthesia. The differences between an osteocentral and a transcortical are that perforation can be stopped immediately after passing through the cortical plate, as you are now immediately in the cancellous bone. The sensation is also completely different and is that of one single pop through the cortical plate. In this case, it is advised to use the 27 gauge 16 mm needle due to the thickness of the cortical plate. Regarding the protocol, it is made up of 3 easy steps. Before starting, make sure that the device is set in I/O mode. The white LED should be lit on the handpiece. Position the D mark on the needle hub in the window of the lip protector. Then present the needle with the D facing directly opposite the gingiva towards the base of the papilla, with an angle of approximately 15 degrees compared to the tissues. The first step, consisting of the anesthesia of the attached gingiva, is paramount regarding the painless anesthesia. Place the bevel on the tissues and advance it very superficially, while at the same time starting the drop-by-drop flow of anesthetic with the grey foot pedal. Once you have obtained the residual blanching, release the injection pedal, remove the handpiece, reposition yourself and prepare for step 2. Make contact with the bone at the very top of the interdental papilla and adjust the angulation so as to be aiming towards the center of the cancellous bone in between the two teeth. Warn the patient that they will hear a noise and feel a slight vibration, and then start the rotation by pressing continuously on the orange pedal. The rotation is discontinuous. During the rotation, perform a back and forth movement until you have reached the required depth of penetration. Then release the rotation pedal and press immediately on the injection pedal in order to start step 3, the intraosseous injection. You may warn the patient that they may feel a slight increase in heart rate and that it is completely normal. This is due to the effect of the adrenaline. Once you have delivered the necessary amount, remove the handpiece without rotation, put it down, and start working immediately. Intraosseous anesthesia can be used on adults and children. Children are smaller, therefore we use a smaller 9mm 30 gauge needle, and we use a reduced volume of anesthetic. An important difference between the protocol for adults and children is that up until the age of approximately 10 or 12 years old, you will hardly ever need to perform a rotation in order to access the cancellous bone. Manual pressure is sufficient. To obtain a successful intraosseous anesthesia, certain parts need to be planned in advance. The first is the choice of the injection site. To choose the correct injection site, one must use a radiograph to locate the easiest access to obtain the desired anesthetic effect. The second is the type of anesthetic product. Any type of anesthetic molecule can be used, but the most common and effective in most countries are articaine or lidocaine. The use of adrenaline is recommended to increase the effectiveness and reduce the systemic toxicity of the anesthetic. An adrenaline concentration of 1 in 200,000 is ideal for the treatment of asymptomatic teeth and extractions of teeth with no periodontal problems. The duration of the anesthetic effect is normally from 30 to 45 minutes. An adrenaline concentration of 1 in 100,000 is recommended for the treatment of symptomatic teeth with pathology. The duration of the anesthetic effect will be normally from 45 minutes to 60 minutes. Finally, the adrenaline concentration of 1 in 80,000 can be used to increase the time or for treatment of irreversible pulpitis. The duration of the anesthetic effect is normally from 60 to 75 minutes. It is important to also remember that the anesthesia is effective immediately. To optimize time, it is a very good idea to plan the anesthetic act before the patient enters the clinic and have everything ready to start working as soon as the anesthesia delivery is complete. The third parameter to take into consideration is the quantity to deliver and the diffusion. These images represent the effect generally obtained with the delivery of 1.8 milliliter calpule. The effect of the diffusion of the same amount of product will vary depending on where and how much is injected. In the mandible, the diffusion is mainly mesial. Choose the injection point distal to the tooth to be treated, especially for teeth devoid of pulpal circulation or inflammatory tissues. For asymptomatic teeth, a mesial intraosseous injection will also provide sufficient local anesthesia for the tooth just distal to the injection site. In the maxillary, the diffusion is distal and mesial. Choose the injection point which provides you the easiest access. Taking this into consideration, the quantity of anesthetic injected should be adapted to the volume of cancellous bone, to the number of teeth to anesthetize, and to the length of procedure time required. This slide shows an animation of the diffusion process. Apart from giving you the possibility to treat various teeth with one injection, the diffusion of the anesthetic with intraosseous anesthesia also has other advantages. Indeed, unlike with infiltrations or ID blocks, with intraosseous anesthesia, all of the attached gingival tissues will be completely anesthetized thanks to the diffusion from the cancellous bone through the Volkmann canals and Haversian system. This means that no supplemental lingual or palatal anesthesias are required, even for a simple extraction, deep scaling, root planning, rubber dam clamp placement, or any type of gingival manipulation. The diffusion remains contained in the cancellous bone and attached gingival tissues, but will not have any effect on the patient's soft tissue. Therefore, you can eliminate any risk of lip, tongue, or cheek biting. You will gain in customer satisfaction, as they will leave the practice and be able to proceed with their everyday activities without the handicap of a baggy lip for 3 to 8 hours. For your aesthetic treatments and veneer placements in particular, the patient will not lose function of their lip, enabling you to easily assess the smile line for a perfect result. You can also optimize appointment management. Indeed, it is very rare for most dentists to perform bilateral ID blocks in the same appointment due to the postoperative side effects of the anesthesia. With intraosseous anesthesia, you can perform multiple quadrant treatments as you know the patient will not feel the anesthesia. Regarding the contraindications and limits of intraosseous anesthesia, during the medical checkup, your patients will inform you of any specific medical issues that they have. The ones to pay attention to, and this is related to all local anesthesia techniques, is the pheochromocytoma and allergies to sulfites. Related to intraosseous anesthesia in particular, patients on intravenous bisphosphonate therapy, patients with a history of head and neck irradiation, very small interdental spaces, infected areas, periodontal or periapical pathologies. For the last 3 cases, it is possible to choose a different spot remotely and increase the quantity of anesthetic to compensate for the distance to target. And it is also important to remember that QuickSleeper is like a Swiss Army knife, and when it is impossible to perform an intraosseous anesthesia, then you can switch to another injection mode and deliver a painless, conventional local anesthesia injection. Now we are going to talk about the most frequently asked questions relating to the clinical side of the technique and to the practical side. Needle breakage. Can a needle break? Yes, a needle can break, but when it breaks, it is almost always at the plastic hub, and therefore it is extremely easy to remove it with a pair of tweezers. Change it and continue the procedure as normal. Needle breakage is always due to a mistake in the protocol. So to avoid it from happening, it is important to respect the following points. Correct needle angulation. Take multiple stable support points on the patient so that if the patient moves, you move with them. Warn the patient that they will hear a noise and feel a vibration before launching the rotation. Root damage. Is it possible to damage a root? No, it is not possible to damage a root, and to understand this, it is important to understand the anatomy of the area concerned and to remember that intraosseous anesthesia with QuickSleeper is painless. If the angulation chosen is incorrect, then during the perforation, the patient will start feeling something. The bone is not innervated, therefore the only sensitive part during rotation could be the periodontal ligament. If the patient starts feeling something, then simply stop the rotation by removing your foot from the orange pedal. Check the angulation of your needle. Is it too mesial or too distal? Remove the needle, change it if there have been over 3 or 4 rotations, reposition yourself with the correct angulation and start the rotation again. Why would you use intraosseous anesthesia in the upper jaw? First, for the efficiency. Infiltrations do indeed generally work very well in the upper jaw, but sometimes for long canines or upper molars, the palatal root will sometimes not be perfectly anesthetized. With intraosseous anesthesia, it will always be effective, even in these specific cases. The second reason is for the patient appreciation. By eliminating the palatal injections, your patients will of course be very happy. And finally, for the lack of numbness. Take again the example of placing veneers on the front teeth. A patient who is paying money for an aesthetic act will highly appreciate to take advantage immediately of their new smile, and will be certainly very open to recommending the quality of work received at the practice. And last but not least, the more you do something, the better you become at it. This is entirely true for intraosseous anesthesia. Those who use it in first intention, whenever and wherever they can, are the ones who use it the best and get the most satisfaction and return on investment. Can we use intraosseous anesthesia with implantology? The intraosseous injection provides immediate anesthesia of the attached gingiva and the cancellous bone, making it the ideal approach for short, flapless implant treatments, or those involving minimal flaps with attached gingiva. But QuickSleeper can also deliver an infiltration necessary when a flap is required. So yes, it is completely possible to use intraosseous anesthesia and QuickSleeper for implantology. It is rather frequent to receive questions regarding the difficulty of penetrating the bone. Difficulties penetrating the bone can be of three reasons. The first is the point where you make bone contact. Indeed, the further you move away from the top of the papilla and the thicker the bone becomes. It is extremely important to make bone contact as indicated by the A marker at the summit of the papilla. The second factor is the angulation. It is very important to get a good 45-degree angulation compared to the lower molars for the osteocentral technique. If your angulation is too vertical, then you will find it very difficult or impossible to access the cancellous bone. The third parameter is incorrect chair positioning. Your chair positions for the rotation are essential to give you a direct view of the perforation site and of the correct angulations. Maxillary perforations should be performed at 9 o'clock compared to the patient, whereas mandibular perforations should always be performed at 1 o'clock compared to the patient. Needle blockage is detected when, after starting the intraosseous injection, the QuickSleeper suddenly stops injecting, you hear a beep and the device shuts down. The shutdown is there to prevent the cartridge from breaking due to excessive pressure. If a needle blocks, then you simply need to change it using the needle unscrewing and screwing buttons on the handpiece. To prevent needle blockage, make sure you choose the right penetration point and angulation, as seen previously. Be as light as possible during the rotation and do not put excessive pressure on the handpiece. Perform a back and forth movement during the needle rotation to help eliminate the bone debris. And a very frequently asked question is regarding the disadvantages that can be associated with the device and with the technique. The only disadvantage is probably the learning curve. It is a new device and a new technique, and there will be a few hurdles before you become an expert. You really have to do it a lot and communicate all of your questions and concerns to your experts so that we can help you and guide you along the way. This way, rapidly, like thousands of QuickSleeper users around the world, you will benefit from 100% of the advantages that this great technique can provide every day. All questions have answers and all problems have solutions. So stay motivated and contact us if you have any problems. You now understand that the applications of the technique are extremely versatile, and intraosseous anesthesia will have a positive effect for almost every treatment. In the current situation, from a practice management perspective, the efficiency associated with the immediate effect and productivity achieved by optimizing long appointments with multiple quadrant treatments make intraosseous anesthesia with QuickSleeper a major asset towards increasing time efficiency and productivity. Now it's time to start or continue practicing. If you haven't already, sign up or log in to the My DHT customer area through the Dental High Tech website and continue your practical training with Bob. You will find everything necessary to become an expert on intraosseous anesthesia with QuickSleeper. Thank you once again for choosing intraosseous anesthesia with QuickSleeper. We count on your motivation and implication to ensure your complete satisfaction. If you require any additional support, then please contact your local QuickSleeper expert who will answer your questions or put you in contact with a clinical trainer to help solve any problems. Please also feel free to contact the Dental High Tech advisors using the number or email indicated on the screen.